Welcome to the Indiana Medical History Museum. This is a new crowd for us. How many of you guys have not been here before? This is amazing. We have a lot of regulars who come to our events and we love them, and we have a lot of them here today, but we have quite a few folks who are here because of the Indiana Theodore Roosevelt Association, and so that is very exciting for us to be able to share this wonderful space and the wonderful speaker that we have lined up for you today. So welcome and thank you. And speaking of the Indiana Theodore Roosevelt Association, we want to thank them for teaming up with us to bring you this event today. Now I would like to introduce David Owens from the Indiana Theodore Roosevelt Association to say a few words and to introduce our speaker. Thank you.
Well, hello, I'm David Owens, David Mark Owens. I get to be president of the Indiana chapter of the Theodore Roosevelt Association, and I see a lot of friends. I want to do just 2 or 3 things briefly. First of all, how about some appreciation for Sarah and Danielle and the volunteers here? What a cool thing, and I'm so pleased that we can pull this together and cooperate. Then to our Theodore Roosevelt chapter people, if you are a member of the Indiana chapter or the national chapter, raise a hand and let's see, we're among friends, aren't we? All right, very cool. Put them down. That's enough. Both groups would love to have you more involved, and we welcome you to do that. Now, a final kind of housekeeping thing, and then I'm going to introduce Dr. Feldman. Is anybody in the witness protection program? I'm going to take some pictures in a minute, and if you don't want your picture taken, just keep doing this item, and that'll be great. Or tell me afterwards, and yeah, there we go. Okay, great, thank you. We want to make sure and use this as another platform for. They've had some great programs here, but we want to use it as a platform to both encourage folks to be involved here, but also with our Theodore Roosevelt chapters. There's so many good people here, and I'm pleased that you're here. Well, the man of the hour, and I want you to make him feel very welcome. And I've got just a few. He could, one of those people you cross paths with, you say, this guy is pretty cool, and this woman's very cool, and this is one of them. This is somebody you want to know, and make sure and introduce yourself both personally. But when I finish this, wait till I'm finished. Give him a warm welcome. Will you do that? And we greet you folks for being here, and we also greet the folks online. Let's see here, and we're going to have a great day together. Richard D. Feldman, MD, is a graduate of Indiana University Bloomington and a 1977 graduate of Indiana University School of Medicine. After completing 1 year of psychiatry, am I saying that right? Psychiatry, thank you. It wasn't my strength. Residency at Indiana University, he finished his postgraduate medical training at Franciscan Health Indianapolis Family Medicine Residency in 1980. He's had a long career. That sounds like he's really old, doesn't it? He's had a long career as a family physician. He's not that old. At Franciscan Health Indianapolis, where he served from 1981 to 2018 as program director of the Family Medicine Residency Program. He now continues as program director emeritus. He is an assistant clinical professor at Indiana University School of Medicine and associate professor at Marion University College of Osteopathic Medicine. Dr. Feldman is the author of 3 books, and they're good. Make sure and get them. Does he have? This is your chance. Home Before the Raven Calls, Family Practice Stories, and What Our Patients Have Taught Us. I particularly like that third one. All published by IU Society Press, Indiana Historic Society Press. He has also authored other medical and historic articles. Yes, he has. He is frequently invited speaker nationally, regionally, and locally on historical, clinical, and medical humanities and public health subjects. Feldman has been an editorial columnist writing on health and public health policy issues for the Indianapolis Star, the Indianapolis Business Journal, and many other newspapers across Indiana. He has been involved with the legislative issues at the Indiana General Assembly for over 30 years. Dr. Feldman served as, I didn't touch anything, sir. Dr. Feldman served as Indiana's 20th State Health Commissioner from 1997 to 2001, appointed by Governor Frank O'Bannon. He's been active on the boards of multiple national, state, and local health-related organizations, cultural nonprofits, and state governmental agencies and commissions. He's received numerous awards, and his resume goes along a lot longer. He's received numerous national and state awards for his dedication. You better be pretty good after this introduction. For his dedication to family medicine and public health. Dr. Feldman has also received 2 Sagamores of the Wabash from Governors O'Bannon and Holcomb, and 2 Distinguished Hoosier Awards from the Indiana General Assembly. Dr. Feldman and his wife, Becky, she's around, there she is also a physician and lives in Indianapolis. Will you make him welcome? It's going to be a good day.
So thank you, David, for that introduction. And thank you, David and Sarah, for the invitation to speak today. I want to first give you some background on this presentation today, the evolution of this presentation. This presentation is directly based on a recent article that I co-authored in the Theodore Roosevelt Association Journal. And the first thing I want to do is acknowledge my co-author of this article, Dr. William Dick. He's a retired Indianapolis nephrologist, and I hope he's online today with us. Well, last year, Bill wrote a marvelous article for Traces magazine of the Indiana Historical Society. And that article focused on the 2 surgical procedures that Theodore Roosevelt had subsequent to a serious carriage accident and a significant leg injury. And he focused on those 2 operations, but he also suggested that accident and that leg injury ultimately was connected to his death in 1919, over 16 years later. That intrigued me. I thought that was fascinating. And it sparked my interest in this historical event. So when I was asked or invited to write an article on such a subject, the medical justification, I pulled in Bill Dick. And together, I think we created a very compelling story for that conclusion, for that connection between the injury in 1902 and his ultimate death in 1919. You know, it occurred to me that there was never a detailed medical justification connecting his death with that 1902 injury. And I thought that was amazing because of over the last century, more than a century, of volumes and volumes and volumes of material written by about President Theodore Roosevelt, that no one ever wrote that medical justification. So, until now. So this is what you're going to hear today. So let's get started with the wound that wouldn't heal. Well, I want to introduce you first to the 26th President of the United States, President Theodore Roosevelt, and his family. And I want to draw attention to the little boy on the left, resting his shoulder tenderly on his father's shoulder. And this is little Quentin Roosevelt, the youngest son of the president. And Quentin Roosevelt became a World War I combat aviator in the elite First Pursuit Group. And he was shot down and killed over France in July of 1918. It's said that his death crushed the president. He was devastated. And I think of his death as the other wound that would never heal. So, our hypothesis: a direct connection exists between the injury to Theodore Roosevelt's left lower leg from the carriage accident of September 3rd, 1902, and his death on January 6th, 1919. So, upon assuming the presidency after the assassination of President William McKinley, and Roosevelt was his vice president, Roosevelt initiated the practice of presidents campaigning in the midterm elections for fellow candidates. And in 1902, he conducted an extended speaking tour for that purpose. He was all over New England, the South, and the Midwest. And on September 3rd, 1902, after speaking in Vermont and then in Springfield, Massachusetts, he was traveling to a speaking engagement at a country club in Pittsfield, Massachusetts, when he was involved in a very fateful and catastrophic carriage accident. Roosevelt was traveling in the presidential landau, which was a luxury carriage, open air. Others in the landau were Massachusetts Governor Winthrop Murray Crane, Massachusetts Congressman George Lawrence, the president's secretary, George Cortelyou, the driver, D.J. Pratt, and Secret Service agent William Craig. And William Craig was formerly Queen Victoria's bodyguard. And here's the scene of the president's procession and entourage traveling down a main street in Pittsfield, Massachusetts that day. Well, the mayor of Pittsfield, Daniel England, notified the Pittsfield Electric Street Railway to discontinue all operations coming into and within a restricted area until the departure of the president from that city. All roads had been secured going in except one, Howard's Hill intersection. And the railway superintendent, for some reason, allowed the South Street motor car to run below the restricted area. That proved to be a very fateful and unfortunate combination of decisions and events. Well, the motorman of the trolley car was Luke Madden. Well, for some reason, he was unaware of any special orders pertaining to TR's visit. And coming over a hill, and he saw the president's carriage. He applied the brakes. He slammed on the brakes, but it was too late. And the trolley was traveling at top speed and maybe too fast, it's been said. Smashed into TR's carriage, throwing it on its side, and the carriage was reduced to complete wreckage. All the occupants of the president's carriage were thrown out. Agent William Craig died instantly. He stood up before the crash in an attempt to protect the president and was thrown out of the carriage and under the wheels of the trolley car. He died immediately. And he was the first Secret Service agent to die in the line of duty. Well, President Roosevelt was found 20 feet from the carriage. He suffered, as you might imagine, multiple cuts and bruises and abrasions, including a deep cut to his chin and a contusion to his left lower leg. Now, others were injured as well. The driver had a broken jaw and a dislocated shoulder, and his secretary was found unconscious with a head injury. Later, it became the most significant injury to the president was that deep leg contusion. And here's a picture, a photograph of the carriage. You see the bent wheel, among other things. And here's the scene sometime after the accident. There's the trolley car in the middle of the street, it appears. And over on the left, you can see the bent wheel. Now, the configuration of the tracks and the road were very unfortunate as well, because this is one of the few areas that the train track crossed the middle of the road to get to the other side. So it was a narrow road, and for a carriage to go down the street, they had to cross over the tracks. And it was a setup for a catastrophic collision. Well, the president was taken to a house across the street. Dr. George Lung, his personal physician, attended to his injuries. Madden, who was the motorman of the trolley car, was found guilty of manslaughter, was fined $500 and 6 months in jail. The coachman of the motor car also was arrested, but he was later released. Authorities were not in a very good mood. Well, Roosevelt was clearly distraught, but in that invincible Roosevelt tradition, he carried on, he continued on. And he traveled on to nearby Lenox, Massachusetts to speak. And he continued his Massachusetts segment of the tour, but it did not engage in any further speaking. He continued on after a little while to a number of southern states, including North and South Carolina and West Virginia, and then on to the Midwest. All the while, his leg wound continued to worsen. When he reached Cincinnati on September 20th, the wound already had become quite painful. In Detroit, he was seen limping. And in Indiana, he had speaking stops in Logansport, Kokomo, and Tipton. And by the time he got to Noblesville, Indiana, his leg was extremely painful. And here, these are stereo cards from the Indiana Historical Society. And this is the president speaking in Tipton, Indiana, and in Noblesville during that tour. Well, in Logansport, the decision was made to seek medical consultation regarding this leg wound. Senator from Indiana, Albert Beveridge, met the train in Noblesville, and the Secretary Cordieu asked for him to arrange a physician to examine someone in the president's party. Well, Beveridge requested that Dr. John Oliver meet the train in Indianapolis. And sitting with Dr. Oliver was Dr. George Cook, colleague of his. So on September 23rd, remember this all started with the accident on September 3rd. Roosevelt reached Indianapolis, where he addressed a huge meeting of Spanish-American War veterans at Tomlinson Hall, which was on the corner of Delaware and Market Streets downtown. 4,000 people attended the 40-minute speech, including prominent Indiana politicians. After the speech, there was a luncheon at the Columbia Club on Monument Circle. And after the luncheon at the Columbia Club, he spoke from the balcony of the Columbia Club. Again, he was seen limping as he addressed this huge throng on Monument Circle. And the president proceeded with these speeches despite being in incredible pain. And part of it was because he was highly motivated to give these speeches, especially the one at Tomlinson Hall to the Spanish-American War veterans. As you, I'm sure, know, that he was a lieutenant colonel in the Spanish-American War in 1898. He had incredible loyalty and respect for Spanish-American War veterans. And as I'm sure you learned in school, he led the charge with his Rough Riders up San Juan Hill. And on the lower photograph is the huge crowd on Monument Circle listening to the president's speech. On the top right is the entrance to St. Vincent Hospital, and of course guarded because that's where the president was taken, and we'll get to that in a minute. Now, there's not a whole lot of photographs of the president in that 1902 visit. So I threw in, if you don't mind diverging a little bit, to 1907. He was in Indianapolis. He came to Indianapolis at least 10 times in an official capacity. And why? Because Indiana in those days was a very, very important political state. And it had a lot to do with the electorate from probably the mid-19th century. Anyway, he was in town to help dedicate the statue of General Henry Lawton. Lawton was a Civil War hero, Congressional Medal of Honor winner. He served in the Indian Wars, and he's the guy that captured Geronimo. He served in the Spanish-American War, and then eventually was killed in 1899 during the Philippine insurrection. He was a Hoosier from Fort Wayne. This is the scene of the dedication outside the Monroe County Courthouse, which was on Washington Street between Alabama and Delaware. One of the reasons I want to show you this photograph after that long introduction was look at the posture of the president. It's so typical Theodore Roosevelt. He leans into the audience like I've never seen anybody do. He was a very passionate and engaged speaker. Typical pose. Wouldn't you agree, Teddy?
Absolutely.
Okay. This is another photograph that I love. Again, let's see, also from the 1907 visit. He was, I think, having lunch at the home of his vice president, Charles Fairbanks. And here's the president. Here's Charles Fairbanks, his wife, Cornelia, Indiana Governor Frank Hanley, Senator Beveridge, and who's this guy? James Whitcomb Riley. Above him is Meredith Nicholson, author. And way over here is Tom Taggart. Tom was the mayor of Indianapolis, national chairman of the Democratic Party, and most importantly, owner of French Lick Springs Hotel. Well, Dr. Oliver and Cook met Secretary Cordieu, who introduced them to the president's physicians, Dr. George Lung and James Richardson. It was at that moment that the physicians realized the patient was none other than the President of the United States. And all four physicians traveled together to Tomlinson Hall. So they examined Roosevelt after his speech there and prior to the Columbia Club luncheon. Well, after the Columbia Club speech onto Monument Circle, he was taken secretly to St. Vincent Hospital in downtown Indianapolis. Well, that large crowd was waiting for the president to reappear after his speech, and he didn't appear. And quickly, there were rumors in this huge crowd that the president was sick, that he was shot, and that the rest of his speaking tour would be curtailed. Here's St. Vincent Hospital, and that was located on the corner of South and Delaware Streets downtown. Well, when the president arrived at St. Vincent Hospital, Dr. Oliver met with the press, and he said, quote, "In order to avoid blood poisoning setting in, it will be necessary for the president to submit to a slight operation." Now, at this point, it's clear that the surgeons or the doctors were unclear if this injury, this wound to his leg, was infected or not infected. In attendance to for the surgery was a team led by Dr. Oliver, with other colleagues from the Indiana Medical College, including Dr. Cook, Dr. Henry Jameson. And Jameson he knew the president because he had visited him in Oyster Bay previously, and also was Benjamin Harrison's physician and attended to the President Harrison during his final illness. Additionally present were the Washington doctors Lung and Richardson. And here's a newspaper photograph of the three Indianapolis doctors. Dr. George Cook was a gastroenterologist. I'm not sure what role he played in all this. Dr. Henry Jameson was a general practitioner and dean of the Indiana Medical College. And then in the center is Dr. John Oliver, a very distinguished and respected Indianapolis physician. Well, in the surgical suite, President Roosevelt displayed his typical personality with some lighthearted surgical room remarks. And he remarked to the surgeons wearing surgical gloves, in those days known as antiseptic gloves, quote, "Gentlemen, you are formal. I see you have your gloves on." One of the surgeons observed and replied, quote, "It's always in order to wear gloves at a president's reception." Well, Roosevelt bantered with everybody throughout the surgical procedure. And throughout the operation, Roosevelt had a smile on his face and expressed that, quote, "an unnecessary amount of fuss was being made over him and that a great deal was being done for a very slight injury." Well, here's the procedure. And the procedure, the description we pulled from various sources. One was TR, A Life, but mostly from the Indianapolis News, another newspaper, the Indiana Journal, and the Indiana Medical Journal. The wound was washed with carbolized soap and water, I'm not sure that was, I think, standard in the day. I'm not sure that was the best antiseptic to use. Local anesthetics were administered of ethyl chloride sprayed over the area of swelling, and we still use that today for local procedures. And cocaine hydrochloride by intradermal injection. Now, cocaine, I don't know if you know, is a fairly good local anesthetic, and it's also a vasoconstrictor. So it was very useful in ear, nose, and throat procedures like nasal packing and so on. And I'm old enough to remember, as a medical student, using cocaine during a nasal packing. That's not done anymore. And I promise you, I did not take any home with me. Well, 2 ounces of perfectly clear fluid, what we call in medicine serum, were removed from the lower leg. And the wound is described in the middle third of the left anterior tibia region. And it was done by needle aspiration. The wound was not surgically opened. And after the serum was withdrawn, they felt the collection of fluid was between the tibial bone and the periosteum. And the periosteum is a very thin membrane that covers bone. So it was locked in that compartment. Well, the swelling went down, and the swelling was about 5 inches long before the procedure. And here's a very important point. One of the surgeons remarked, quote, "There was present about the tumor," meaning the area of swelling, "a pustular folliculitis." Remember that. Well, here's our first medical opinion. There were various news accounts after the surgery, and it was reported that the president had a, quote, abscess, and the surgeons felt the wound was infected. I think there was a lot of confusion about what was said when, because it's clear to us the surgeons did not believe the wound was infected at the time of surgery. And that's based on comments and actions by the surgeons after the procedure. And we are certain that the description of the clear fluid withdrawn indicates the wound was not actively infected in Indianapolis. And that's contrary to popular belief. If you read about this, almost always it's going to say that he had an abscess, there was an infection, and that surgery in Indianapolis saved his life. Well, I don't think so. Not popular to say in Indianapolis, but I think what they did in Indianapolis was to introduce infection into that wound. And remember, it was described that there was a pustular folliculitis overlying where they did the needle aspiration. So the fluid was clear. It wasn't pustular, which would indicate infection. So there's also no descriptions of the president having any signs or symptoms of infection, like fever or chills. What we believe is that the president during that accident suffered a hematoma, which is a collection of blood in the soft tissues. And naturally, the hemoglobin from the red blood cells would be reabsorbed by the body, leaving a clear fluid, serum, a seroma. And again, that pustular folliculitis that was observed, I think, is crucial. And that infection was probably introduced into the wound at that time. Well, at 7:40 that same day, the president was carried to a railroad car for his return trip to Washington, D.C., escorted by a troop of infantrymen. Well, he was doing much better. His pain was much less now. And he actually settled in, laying down with his leg up, getting engrossed in a good book. But the rest of the trip was canceled. Well, Dr. Long accompanied the president on the train. And when it pulled into Washington, it was met by Mrs. Roosevelt. And he was taken to 22 Jackson Place, which was the temporary White House in 1902. And that was to rest and heal. Now, why didn't he go to the White House? Why did he go to a temporary White House? There were extensive renovations being done to the White House. Anybody hazard to guess what that addition to the East Wing, which, as you know, it was just recently torn down, unfortunately. Well, he was instructed, and this is an important point, he was instructed to have complete bed rest for 10 to 14 days. Now, we don't do that today. Whatever you have, we get you up and moving so you don't get a deep vein thrombosis. That was the style of the day. And he showed marked improvement. He was doing much better over the next several days. But by September 27th, the president's condition deteriorated drastically. The pain in the leg escalated. There was reaccumulation of fluid. He developed a high temperature to 105, indicating infection. On September 28th, the next day, he had a second, more serious and extensive surgery after prepping him with whiskey. Sounds like an old cowboy movie, doesn't it? And prepping the wound again with cocaine. The surgeons present, the Surgeon General of the Navy, Admiral Presley Rixey, Surgeon General of the Army, Robert O'Reilly, Dr. Long, several other consulting physicians, including an orthopedic surgeon. And here is a description of that surgery. I think we pulled this from Theodore, the book Theodore Rex. Quote, "The muscles of the left lower leg were cut down to the tibial bone, several inches above and below the highest point of swelling. The bone was found to be roughened and honeycombed." That's important. To me, that means that bone was infected. And those honeycombs are islands of bone trying to regenerate. The abscesses were drained and the infections were scraped down to the bone. The wound was left unsutured so the fluid could drain and the wound would heal better. Scraping of the bone was performed periodically during the operation or following the operation. One of the Indianapolis surgeons had hinted that further surgery might be necessary, but TR recovered quickly with resolution of the fever. Once again, an important point, the physicians advised him to use a wheelchair for 8 weeks and to further rest, probably on the suggestion of his wife, Edith.
Remain calm.
Well, anyway, he was in a wheelchair for eight weeks. And would then move to Sagamore Hill in Oyster Bay, their home.
Oh, yours isn't a touch screen. There you go.
So then chronic problems started with that left leg. And he had chronic recurring problems and infections for the next 16 years of his life. The wound would remain vulnerable to really even the slightest of trauma and recurrently got reinfected. And indeed, in 1908, he wrote his son Kermit, quote, "I have never gotten over the effects of the trolley car accident 6 years ago." He also remarked that the bone was, quote, "permanently damaged." and anticipated, he was told by his physicians, if he injured that leg, he would potentially have serious continuing problems. In fact, another episode of pain and inflammation around this time occurred after his left shin was hit by a branch while horseback riding. And for a couple of days, his physicians were uncertain if they would have to have another surgery, quote, to remove some of the bones in the leg. Fortunately, TR recovered once again after without surgery. Then on his 1914 trip to the Amazon in Brazil, he began his descent in an uncharted river, and they were there to map it. This was a very arduous and dangerous trip. And they descended the Rio da Duvida, the River of Doubt. And that's in Portuguese. We have some Portuguese people here today. I hope I got that right. Did I say it right? Okay. And he injured his left thigh when he was an injury to his left thigh when he was trying to free up a canoe in the water. And he struck his thigh on a very sharp rock, and the wound quickly became infected. It was a deep wound. Interestingly enough, his left lower leg, injured in 1902, flared up with its own infection. And he could barely stand or walk. He requested that his party leave him behind to die. He was that sick. But Kermit, one of his sons, accompanied the president on that trip and would have nothing to do with that. So numerous abscesses appeared in the lower leg and thigh, and eventually they got him by steamer to Manaus by steamer. And he recuperated over a period of weeks at Oyster Bay after they drained these abscesses. Well, in mid-June, while at a Republican convention in Chicago, he experienced an episode of pleurisy. Pleurisy is chest pain with breathing, usually with inspiration. He also had violent coughing and actually even fractured a rib coughing. Dr. Robert Kimberly, in a wonderful article in 1979 in the TRA Journal, The Health of TR, said, quote, he probably had a pulmonary infarct from a pulmonary embolus, and it was the forerunner of what the forerunner of what would cause his death in January of 1919. Well, these are the episodes we documented, but there could have been more. And I think there was one, probably less serious one after this description of this episode. But this was in New York City, where he got another leg infection. The abscess at the site of the old Brazilian thigh injury suddenly opened. The president fainted from pain and loss of blood, necessitating surgical drainage. I think he was systemically infected, and the infection spread to both middle ears and the mastoid bones. The mastoid is the hard bone behind the ear, requiring drainage of the eardrums and a radical mastoid surgery. Well, here's our second medical opinion. We think it's likely that Roosevelt had chronic osteomyelitis, bone infection of that tibial bone. Recall a number of things. He had recurrent leg infections, sometimes with little provocation. During the 1902 surgery in Indianapolis, one surgeon remarked that, quote, the tibial bone may have been affected. And recall that there was evidence of bone involvement during his subsequent second surgery in Washington, and the bone was scraped during surgery and repeatedly afterwards while the wound was open. Also in 1908, there was consideration by his physicians of removing some of the bones of his leg. I don't think they would remove bones of his leg unless they thought it was infected. So there's no way, this happened over 100 years ago, and medical documentation is pretty scarce. And there was no way to definitively know if the president had chronic osteomyelitis. And remember that bacterial cultures were not yet used routinely in clinical practice. And there were no advanced diagnostics like CT and MRI to diagnose a bone infection. And besides, it was nearly impossible to treat osteomyelitis or a deep leg infection because antibiotics did not yet exist. So we come to Roosevelt's final illness. On Armistice Day, 1918, Roosevelt developed a, quote, polyarthritis of his ankles, knees, wrists, and also back pain and sciatica. He was very ill. He was thought to be in critical condition. He was feverish and in severe pain. He was admitted to Roosevelt Hospital in New York City. Now, the arthritis etiology is not clear, but I suspect it was septic arthritis infection. I can't be certain of that, but it was clearly inflammatory. And it was reported that he suffered at least one pulmonary embolus while hospitalized there. Well, once again, the president rallied, and on December 25th, 1918, he returned to his home in Sagamore Hill. He was severely debilitated and unable to care for himself. Late in the evening, the day before he died, Roosevelt had difficulty breathing, and he was being very closely monitored because of the seriousness of his recent hospitalization. Dr. George Fowler of Oyster Bay, his personal physician there, made his usual evening call at 8 p.m. on Sunday, January 5th, 1919. At 11 o'clock, James Amos, his long-term manservant, called for the nurse who contacted Dr. Fowler, and he told him when he arrived that he was having some trouble getting his breath. After a while, he felt better and all seemed well. Edith checked on him at 2 a.m. and found him breathing normally. But then at 4 a.m., Amos thought he heard the president experiencing difficulty breathing once again. He called for Dr. Fowler. The nurse called Dr. Fowler, but by the time the physician arrived, Theodore Roosevelt was dead. The cause was a pulmonary embolus. His longtime servants were inconsolable. Both Amos and his coachman, Charles Lee, had been with the president since his White House days. And they were struggling to contain their emotions, and Lee was heard to say, quote, I have lost the best friend I have ever had, and the best friend any man ever had. This is his funeral in Oyster Bay at Christ Episcopal Church, and he's buried in a cemetery in Oyster Bay. Well, medicine, as you know, was very different over 100 years ago. There were no blood thinners or surgical procedures to treat a pulmonary embolus. And there were no diagnostics like venograms and chest CTs or blood oxygenation determinations and some other blood tests to diagnose a DVT or pulmonary embolus. And I really think that if this occurred today to President Roosevelt, his outcome would have been very much different. Well, let's finally look at the pathophysiology of a pulmonary embolism. As you know, veins return blood to the heart. And relevant to TR's specific situation, blood is returned from the veins of the lower legs, thighs, and pelvis into the inferior vena cava that leads to the right side of the heart. And the right side of the heart pumps blood through the pulmonary artery to the lungs to be oxygenated, and then returns to the heart by way of the pulmonary vein to the left side of the heart, and then to the arteries of the entire body. Well, if clots form in the legs or pelvic veins, it's known as a deep vein thrombosis, a DVT. And a pulmonary embolus occurs when clots travel through the pulmonary artery into the lung, potentially blocking the vasculature there. And that causes PE, causes pleuritic type chest pain, pain with breathing, shortness of breath, and possibly coughing up blood. And PEs are typically life-threatening. And especially if the clot is big enough, or if multiple, extensive enough, and it can even cause sudden death. The patient is hypoxic, they're prone to cardiac arrhythmias, and then the heart is pumping against a fixed obstruction. Here's a diagram, an illustration of a pulmonary embolus. In the circle is a clot in the pulmonary vasculature, but look at the one in the lung. That's called a saddle embolus. That's the worst kind you can get. And that straddles, it lodges and straddles multiple branches of the pulmonary artery. The most dangerous. So what are the risk factors for a DVT or pulmonary embolus? Injury to the veins, inflammation, and chronic deep infections that cause injury, continuing injury to those surrounding veins. Varicose veins or venous insufficiency, which is pooling of blood and stagnant blood, increasing the risk for blood clots. Abnormal clotting proteins, a lot of that is hereditary. Prolonged bed rest or inactivity, heart failure, long trips, smoking, obesity, and cancer, age 60 and older. He was 60, by the way, and a history of prior PEs. This is not an inclusive list. These are some of the major ones. Well, what were Roosevelt's risk factors? Well, the big three were leg trauma. He suffered during the accident, but also possibly during the multiple surgical procedures. Deep leg infections that we know he had, and multiple periods of prescribed prolonged bed rest. That was the style of medicine during the day. He was also 60 years old. He was obese. He had recurrent episodes of inflammation from infections and, I suppose, arthritis. He was a smoker. He engaged in long trips, especially campaigning and in his official duties, and had prior PEs. But we believe that it was that original injury from the trolley accident in 1902 that set off a very unfortunate cascading chain of events and the continual downward course for Roosevelt's health. So Theodore Roosevelt was correct. He had never recovered from that trolley accident in 1902, and that accident would eventually prove fatal. Thank you.
Oh, Go ahead, Dr. Pasquisi.
Great talk. Did he have an autopsy? Because I know it wasn't unusual to say he died from this or that nobody really knew for sure.
No, as far as we know, oh, I have to repeat the question. The question is, did Theodore Roosevelt had an autopsy? That's an excellent question. And we couldn't find one. There's no record of one. Nor would I think they would be eager to do one. But yeah, no, I don't think he did. And, you know, piecing this together was difficult, as I think I mentioned. This is over 100 years ago. Medical records are not what they are today. And a lot of them, I think, they've been lost, you know, over the years. So it would have been good to know, but that was all I know is that was the clinical diagnosis when he died. David.
Do you have any sense as to how the gunshot wound he sustained during the assassination attempt might have contributed to his death?
So Roosevelt, I think it was in 1912, he was shot while campaigning. Oh, the question is, did that injury, that gunshot wound to his chest, have any effect or on his ultimate death? No. He had 9 lives. And that bullet hit his, I think, a metal glasses case and his speech, which was probably about this thick. And it didn't penetrate very far. He was bleeding, and he actually did a huge speech while he was bleeding after the, but no, it would not have had any effect. Frank.
Thank you so much for your presentation. I'm here for a couple of reasons. Number one, I was related. And number two, I had a similar injury. I had a hematoma that developed into a DVT at the age of 19, having been struck by an automobile low in the leg and going through the windshield of the car head first. That was at age 19. And I was amazed, back in the day, you know, what, 59 years ago, all they could do for me was to wrap my leg in an ace bandage, give me a pair of crutches and say, good luck, young man. All right, and fortunately, within, see, I was in the hospital 10 days, and that's just by Thanksgiving, it miraculously went away. And I had a subsequent occurrence when I turned 65 that was close. Yeah, but I mean, I'm wondering if this thing's gonna break and go to my lungs and brain at some point yet. And here I am, 78 years old.
So the question was, Frank Sauer here, a loyal reader of my columns, let's say, had a DVT from an accident, similar to President Roosevelt. And then he had a recurrence.
And at 65.
65. Frank, I would say you're safe.
Send the bill.
Right there.
Do you think he suffered a brain injury during the crash?
The president? The question is, did he have a head injury, a brain injury during the crash? No, I'm confident he did not. His secretary did. But no, he had no significant head injury, and went on and spoke, gave speeches after the accident. So no, I don't think so. Yes.
Hi, I'm sorry, my name is Lisa. So I wondered if the influence of sterility plays a factor with like the medical tools. We know they use antiseptic gloves, but I don't know how prominent like sterility as far as the scaffolds and things like that were introduced, and we're bringing into fact like infection. And I think that maybe that may have influenced a lot of things. I'm not sure. what's your opinion?
Yeah, so the question is, the techniques of the day over 100 years ago, was antisepsis what it is today? Did that contribute to this whole issue? I'm sure it did.
Yeah,
I'm sure it did. Now, you know, germ theory of infections was established back in the 1880s. Louis Pasteur, Lister, Koch, Koch, Poach, I don't know, Pope, whatever, how you pronounce that. We knew by then we knew there were germs and
Right.
bacteria. But the antiseptic techniques, as I think I alluded to, is not the standards of today.
right.
I mean, they knew to wear gloves, they knew to try to wash it. What they were thinking when they put that needle through the folliculitis, I don't know what they were thinking. Maybe they had no choice, I don't know. But no, it's not what it is today.
Okay, and maybe even the wound care, the aftercare of it, you know, like making
Could have
sure
been.
it's clean
Could have been.
properly, and things, I don't
Yeah.
know, this may be things.
And I don't know the detail. Did they really sterilize instruments, or they just clean them all? I don't know.
Yeah, okay.
That's it. This young gentleman's been waiting for a while.
Here, in the blue shirt?
Yes.
Blue shirt.
So, this is what I heard from the stuff that I heard. So I heard that his leg was break and his subclavian injury. Also,
You talk about the lungs or the chest? Okay, what's your question?
I don't know. His stuff, his stage.
Well, so he's asking what the process was for the injury. I think that's the question. What process? He had a leg injury and then he had this lung problem, and what was the process? Is that what you're asking? So I think he developed a blood clot in his leg. And over many years, he had more clots and more problems, more injuries to the veins. He threw a clot into his pulmonary artery, and that blocked the lung, and he died. Pulmonary embolus. So a clot traveled from the leg to the lung. And if it's big enough, it can kill you. The lady in white up there.
Yeah, was it ever suggested that another amputation of that leg is?
Amputation?
And you know,
No, the closest to that was the idea of removing some of the bones in the leg. I don't know what bone they would have taken out of in the fibula that is non-weight bearing. I don't think that was his problem. You're right. The best course may have been amputation of that leg. But no, we did not, never heard of any thought of doing that.
We have a couple of questions online.
Okay.
That are ones that came in earlier. Deborah McLean asks, was TR diabetic?
It was TR diabetic, not that we know of. He was obese, but no mention of diabetes.
Actually, some of these we've already touched on, so continue.
Talk about when I was in school, anyway, consistent. And it was one of those who heard about it, and to see it. As a resident, in the 70s, we had a patient, one of the staff guys that kept spitting silk sutures after all surgery, intraabdominal surgery. Kept spitting these things, so you go and take my staff, keep getting those out. If they have chronic infection, they'll get amyloidosis. And again, that didn't mean anything to me. Well, now you're hearing about all these entities as a cardiac thing and some other disease. And I wonder if he didn't sequester it's chronic infection. And I guess, but it's so I mean, nothing up, but it's kind of came to mind with chronic infection. And that's way out of, I mean, retired surgeon, so that of course I really don't have to go. You had medicine, is that make any sense or?
Boy, so the question was, could he have had amyloidosis as a contributing factor to all this with the chronic infections and so on? I am not aware of that association. That's above my pay grade too. But I've never heard of that. I've just never heard that. Teddy, yes.
Toward the end of your slide, you showed one that had risk factors for Mr. Roosevelt. And I do not disagree, obesity was a problem for him. But you had one on there which caught me off guard. And you had him listed as a smoker. And no offense, in all my research, for whatever that's worth, I've never seen anything that referred to him as a smoker.
And I came across that same issue. So was he a smoker or not? And it's not very apparent. Matter of fact, we took that out of our journal article. But I did come across some mention that he did smoke cigars. So did he smoke cigarettes? I don't know. But I was convinced that I don't think he was maybe a regular smoker or a heavy smoker, but I think we know that he smoked cigars, and maybe those were at some events.
The little boy, his father gave him a cigar when he was about 5 years old. Go against his asthma that he has that time.
Oh, to treat
That's
it.
the only thing I've ever seen on.
Yeah. I think that's a question, but I came across some stuff that I thought, so I put it in the lecture, but I took it out of the journal article. Fritz.
Yep. Congratulations, Richard, on the talk. And I want to congratulate these two young men and their two good questions here. I have a feeling that you guys will be up there giving a speech. And I hope that happens. Now, a real quick evolution of how today's event took place. The Roosevelt Association started the year after Teddy died. The women at that time started a memorial association. And then it became the Theodore Roosevelt Association. A few years ago, Indiana was asked to start the Indiana chapter of the Theodore Roosevelt Association. And so then this guy heard about it and he became a member, and here we are today. And so we want to congratulate, and that evolution has brought you all here. So don't hesitate a moment in joining the Roosevelt Association.
Well, Roosevelt was an interesting guy, I must say. And one of the most intellectual presidents we've ever had. He wrote 45 books, right? I mean, crazy. But to me, he was an enigma as well, but we won't get into it. Yes.
I wonder had he been someone who had asthma. And then the comment about eating broke rib and he was coughing so hard, I wonder if that might be part of the causation of all this that happened, because he has some recurring problems with his lungs as well. Just take care of
So the question is, we know he had asthma as a child. And he was a sickly child, a frail boy who built himself up, and that's where he came up with the strenuous life to challenge himself. He was a boxer. Became a boxer. Lost the sight in one eye because of that. But the question was that asthma a factor in his lung problems? I can't definitively answer that, but I don't think so. A lot of times when you have asthma as a child, it resolves when you're an adult, not always. But I think his lung problems were from the pulmonary emboli. Now I know he had an episode of pneumonia, but I don't think it contributed to his death. Good question. Dr. Feldman.
Speaking on some posture, but I thought it was peculiar that he had all these different, polyarthritis. That else was peculiar too, and I wonder, I mean, I think if he had like tricuspid, like a septic emboli going on, or something that you may have had pain in multiple areas, if he had maybe endocarditis. But you think he probably would have more persistent shortness of breath, I would think, if it was on the tricuspid valve, but he could have been firing off, septic emboli.
Yeah, that's a good thought, Tyler. My youngest son is a family doctor like I am. And he always asks tough questions. What?
Did he have a tumor?
Yeah, well, we don't have so could he have had septic emboli from?
Right, and could the shortness, I mean, I still think he had a pulmonary end,
Yeah,
but you wonder, the polyarthritis was probably the most bizarre. Because
it is
I
bizarre.
would think that they would get a septic joint at the site of infection. If you're getting multiple areas and it wasn't an inflammatory condition, I'm wondering if he was firing off septic emboli. But he could have had two things going on, still could have had.
Yeah. Again, I did not entertain that septic emboli. I think that would have been a lot harder to diagnose back then.
Yeah.
It's hard enough now with our ultrasounds of the heart and so on. I don't have any indication he had septic emboli. I assumed that his chronic infections that never really went away probably seeded themselves. And I don't know if it was, that would be on his right side of the heart, tricuspid valve.
Yeah.
Right.
But I think it would have been more persistent shortness of breath.
I think he would, I think he would have had a rapid downhill course. It wouldn't have lasted this long. Any other questions? Yes.
Dr. Blunt, college roommate died at the age of 49 from a pulmonary embolism, which struck me as terribly young. Now, my wife and I had dinner with he and his wife about 6 months before he died. And that night, his face was kind of cherry red. He had trouble getting his breath and complaining of pain in his left leg. Is it possible I was observing symptoms of that embolism 6 months before it happened?
So he was having shortness of breath, did you say? Did he have shortness of breath, did you say? Shortness of breath?
Yeah. Not ordinarily, but he was that night.
Yeah, so the question is personal experience with a friend. He had shortness of breath and leg pain, and 6 months later he died of a pulmonary embolus. So is it possible that when you had dinner with him or something, or met with him 6 months previous, was that the pulmonary embolus? Did he have any other risk factors? Did he have risk factors for a pulmonary embolus? He's 49 years old.
Well, he did smoke. He did drink a little, but not much. He was overweight.
Yeah.
Was not very athletic.
Yeah.
He would never go out and play golf with me for anything.
Right.
And,
So the question is it possible over a 6 month period to be experiencing pulmonary emboli and then finally dying of a pulmonary embolus?
what is this? The embolism initially formed in his leg and made its way all the way up to his lungs.
Right, that's the whole process. That's the whole process. But what he could have been doing, he may have had some hereditary problems with clotting factors, and clotting proteins, and he was vulnerable to DVTs, and he was having showers of smaller pulmonary emboli, and then had the big one. And I think that's very possible. Yes.
One more question. Anyone have one?
After the scraping of the bone, okay, he breaks a rib coughing, which seems an ornament to me, by coughing, break a rib. And then he gets arthritis, rheumatoid arthritis. Does the scraping of the bone indicate that something changed in the bone structure?
No, I think, so the question is, what's the significance of the bone scraping, the abnormal bone? I don't think that has any other significance, like inflammatory arthritis. You mentioned something else. No, I think that infection was overlying bone and affecting the bone. And that's why they said they scraped the infection off the bone.
It didn't.
Well, not quite. Because that bone was involved with infection. That was that honeycombed appearance. It was abnormal. And that, I think, eventually led to osteomyelitis. But I don't think any of the other conditions. He may have had a rheumatoid arthritis. We don't know. There was no history of that until he had this horrible illness. That's why I wondered if it was a septic arthritis of some type. And he had evidence of other systemic infections, like when he had the leg drained, and then he had ear infections and mastoid infections. He was systemically infected. And we're not used to seeing that today because we have antibiotics. I think I saw one mastoiditis in my whole career because we had antibiotics during my career. But typically a kid with an ear infection would end up with mastoiditis because they didn't treat with antibiotics.
Thank you all very much for coming.
Thank you.